this one's starting. Okay, very good. Okay, hello everyone. Dr. Rich Castellano here, double board certified facial plastic and reconstructive surgeon. We're here today with Evelyn. Thank you so much, Evelyn, for allowing us to share. We're going to be doing a radius injection to some of the smile lines and a little bit in the cheeks. And you can see in her pictures here, Evelyn looks great. She knows the power of smile, and she just wants to fill a little bit in the creases. She did some radius not too long ago. We're adding a little bit in, but you see she looks natural. And so the goal is to give a little more volume in those areas. So what I like to do is I start with the cleansing, and she has her ice pack, and I'll do a little bit of the numbing medicine. Now Evelyn is a nurse, and she has a medical background, so we're very proud to serve her and help her with her goals. And can we share with them, Evelyn, how young you are, dear?
Yes, 72.
72, and she looks great. Many active years ahead of her yet. I like to do the HIBA cleanse. So this is it. Hello, thank you for joining in. So this is the HIBA cleanse. Hello, thank you, Giselle, for joining in. So I'm doing a little cleanse. Evelyn, I'm going to take your glasses off here. Is that okay? Thank you so much. Okay. So I like to do a little bit in the smile lines and a little bit in the cheeks. And so for those of you that have never done radius before, it's a great filler. There's good volume. It's calcium based. It will show up on an x-ray. It doesn't really block so much. It's a small amount. But it's calcium based. Lasts about a year to a year and a half. Some people say 9 months or less, but usually get about a year from it. Once I do the cleanse, I like to use my little buzzer device. Hello, Helen. Thank you for joining in. And then the 1% lidocaine with 1 to 100,000 epinephrine. That is a very tiny little 32 gauge needle right there. So you'll feel buzz. And I'm going to have you rest your head all the way back. There you go. You'll feel buzz, and then you're going to feel a little pinch on 3. 1, 2, 3, pinch. Someone said that the HIBA cleanse makes them break out. Rarely people have a sensitivity to it. Pinch, but that is possible. So in the health history, we ask those questions. 1, 2, 3, pinch. You doing okay?
Yes.
I'll do a little bit of numbing on this side. Evelyn's tough. You feel buzz and pinch. 1, 2, 3, pinch. Sorry, that's a little pinch there. It's a little more tender. 1, 2, 3, pinch. People say sometimes the second side can be a little more tender. The body becomes alert. The brain becomes alert. Pinch. Okay, so I like to let that numbing medicine set in just a little bit. What I'm going to do is I'm going to zoom for you so you can see a little bit better what we're doing in our technique. Hello, Helen. Thank you for tuning in. So we're going to get up close and personal here. There we go. And right in through here. Perfect. Thank you for the hearts and the shares. And I realize now there's super hearts on Periscope, and that helps us to spread the message, so thank you for what you can do. Hello, Wanpen. Thank you very much for your comments and for joining. So we are in Tampa, Florida, and in the Villages, Florida. You can look us up at imagelift.com. Fillers are the future of plastic surgery. There's no downtime. They look natural when they're done by the right expert, and we have temporary, we have long-term fillers. So now that I've done the numbing, I take this little tiny needle, that's a 27 gauge, 1/2 inch needle, and then you just do this little spot. Do you feel a little bit of a pinch right here? Okay. Little pinch. And then I find where I did you feel a little bit of a pinch here? Okay. So we're just doing kind of a little refresh. She did the fillers not too long ago, and we're adding 1 additional syringe. It's always better to come back another day and do more rather than go too far. And we're just filling up where volume has been lost. So a little pinch here. I'll pinch the skin to see the exact spot I did the numbing. I see just a little tiny bit of the blood, and that shows me, that guides me on where to do the injection. Now this is the radius. And on Facebook, usually they have it a little bit backwards. So that is the radius there. Here's the radius, and that is a 1.5 cc syringe. I add some lidocaine to it. That's the cannula. The cannula is blunt tip, so that is soft, blunt tip right there. And you can see that it's flexible. And so we'll start in the smile lines, and I find that little point that I made. It's like threading a needle. Pressure pinch. Do you feel a little bit of a pinch there? Not too bad?
Not too bad.
Okay, so I like to use my twist and shiver technique. So I'm shivering when I'm giving the filler, and that allows me to put a fine amount of filler over a large area. Okay, so we put a little bit through there. We never get rid of the smile lines 100% because every time we smile, they will deepen again. And little pressure, little pinch. Little pinch there, not too bad. We also had the conversation about long-term fillers today. Evelyn was interested in the Sculptra and the Bellafill, and so we may do that at some point. Every time I talk to my patients, we have our 4 categories: tightening, volume, skin, and then behavior. Of course, behavior is the most important thing for our appearance. Hello, Doris. Thanks for joining in. Now I'm going to put a finger on the inside of your lip here because I like to massage the filler from both sides. Excuse me. Everything's looking good. How are you feeling, Evelyn?
Okay.
She's tough. But you can see how fillers are very easy to do. Rarely I have a patient that they need relaxing medicine for the fillers. If they need it, we'll give that to you, but you need a driver because it's like you had a few cocktails. Pressure pinch, and then we get the little hollows under the eyes or the tops of the cheeks, and I do just a little filler in these areas, and I withdraw a little bit just to make sure we're not in the blood vessel. So I put small amounts on each side, and so we've done a little here. I'm going to do a little on that side, and then we're done. Thank you for joining. Thank you for the hearts and the shares, and thank you for the super hearts on Periscope. We have the bronze status on Periscope. We do a lot of broadcasts with them, and we had over 9,000 viewers on our last surgery yesterday, so we're grateful to spread our message and teaching and training all across the world. Do you feel a little bit of a pinch there? A little pinch, okay. I'm going to turn your head to the side nice and easy. Is that okay for you?
Okay.
Okay, good. So Evelyn will pass the grocery store test today. If she walks into the grocery, no one does a double take. They won't know what she had done. Family and friends, they can't figure it out. And that's the goal. You want to do a cosmetic treatment that people can't figure out. Someone asked how young Evelyn is. She's in her 70s, but she doesn't look it, and she doesn't act it either. She's very active. Everything's looking good.
Did you want me to add?
If you walk around to the side, you can do it on that. Thank you.
You're welcome.
Yeah, right there. That'll block the camera. You're blocking the camera when you do that, so you should probably try and come from this side because the camera's right there.
Oh, I see.
Very good. Evelyn, how are you doing, dear?
I'm doing okay.
I'm going to put a finger on the inside of the lip, and I like to massage that filler a little bit. Turn your head. That's perfect. Thank you very much. Pressure pinch, pressure pinch. Okay, so I've got a little bit left of the filler, and what I'm going to do is I like to show the patient before they're done what we have done and what we have left, and then that way they can decide if they have a certain area that they want to focus on, or sometimes the patients will just say, well, you're the expert, you tell me what I need. So Evelyn, why don't you take a look, dear, for me? Can you see without your glasses? Okay, so we built in through these areas. Did you want me to focus a little more in the smile lines?
Yeah, okay,
I'll do as much as I can. We can't make them gone, but we'll do just a little bit more in those areas, okay?
Okay, all right.
I'm going to do some here, and then just a little touch in the top of the cheek.
What you doing?
I'm going to, both sides.
Okay, thank you.
Both sides. I can't make it perfect.
Perfect, yeah.
If we make it perfect, then people can't stop looking. They think it looks it's a little strange. Rest your head all the way back for me, please. There's flexibility in where we can do the fillers, and some patients have different preferences. So I like to make sure we're following that, and I let patients guide me, and if we need to come back another day, we always can. It's better to do that rather than go too far.
Yeah.
But sometimes, you know, if you get too rigid about your treatment plans, I think it's okay to be flexible because the body has asymmetry naturally. Usually one side of the face is a little different than the other. And of course, we always look our best when we smile. So Evelyn, where do you feel you get your smile from? Were your family big smilers, or sometimes we go through tough times and then we realize how good we have it? Where do you feel it comes from for
Maybe
you?
from the family.
Your family's a good
Yeah,
That's
yeah,
nice.
yeah.
That's so important. Well, we're going to help the world be more like Evelyn by helping them to smile more and helping doctors with bedside manner. If you're a student or a physician watching, make sure you check out our Practice Profitability MD site. Let me turn your head this way, where we're teaching doctors how to run their practices and take better care of their patients. Okay, so we're completely done. That wasn't too bad, hopefully.
No.
Okay, you did great. And why don't you take a look here. So I don't believe in restrictions afterwards. I think there's no restrictions in your activities.
Look good.
How does it look? Do you like it?
Yes, I do.
Okay, good. So you're looking at Evelyn. That's fine, Charlene. And then here are her pictures from right before. So these are the areas we treated around the mouth and the cheeks. And then here you see some of the little bit of the hollows in through here. She looked great before. We're just doing a little bit of a refresh so you can see her pictures. We're on Facebook. Make sure you follow us on Facebook and YouTube and on Periscope under Image Lift. Thank you everyone for tuning in, and thank you very much, Evelyn, and thank you to Charlene. Charlene set everything up perfectly. Make it very easy. Hello, Pedro. Good to see you. Hello, Joyce. All right. It's Practice, the site where we teach doctors. That's practiceprofitabilitymd.com. So practiceprofitabilitymd.com. We'll see y'all soon. Bye. Thank you for joining.